Good morning and welcome everybody to this academic session of the Master's Degree Program in Counseling and Family Therapy. In this session, we are going to have a panel discussion, and the theme is Perspectives on Counseling and Family Therapy. Joining us in this discussion are Professor Matthew Varghese. He's Professor of Psychiatry, Head Family Psychiatry Center, NIMHANS, Bangalore. We also have Professor T.V. Singh, Professor and Chairman, Department of Psychology, IBHAS, Delhi. We also have Professor Rajalakshmi Sriram, who is the Professor of Human Development and Family Studies, MS University of Vadodara. And joining us is Professor Ahilya Raghuram, who is Professor and Head, Department of Mental Health and Social Psychology, NIMHANS, Delhi. Under this theme of Perspectives on Counseling and Family Therapy, we are going to cover a range of issues. To begin with, let me request Professor Matthew Varghese to talk about approaches to family therapy.
If you look at the way that a clinician or a therapist or a counselor approaches family therapy, I would say that first I will talk about the theoretical framework with which the person is going to approach when he does family therapy. The overarching framework to approach family therapy is what is called as a systems theory and systems understanding. This is basically to view the family as a system comprised of different individuals, different components. It might be different subsystems like a parental subsystem and a child subsystem or a marital subsystem. It is useful to use the systems theory because the systems theory lends itself very well to the understanding of an interactive subsystem which is comprised of many of these components. And so systems theory, to my mind, is the absolute basic framework for family therapy. The second theoretical paradigm that is used in family therapy is the paradigm which is that of the family life cycle. The family life cycle are basically the stages that family members go through from the time they start a family till the time the family breaks up and more families are formed. So this is sometimes families that join together and then they bring up children and they move on, and then those families again move on and start their own families. So the life cycle stages have been described by various people, but essentially there are about 8 life cycle stages which you will be seeing in a later course. But the first life cycle stage, for example, is when the husband and the man and the woman get married, and that the first stage is when they are just married and they are forming their marital bond. So the second stage would be when the child is born, and then subsequent stages would be when there are school going children and later on adolescent children and so on. So the life cycle stages are essentially determined by the eldest child in the family. So from 6 to 13 is what we would call, say, the school going period, when the eldest child is 6 to 13. So that is the second perspective, and that is of the family life cycle stage. And this, I would say, is a kind of longitudinal perspective. This is a longitudinal developmental perspective, almost as if it were from birth to death of the family. There are some other theoretical paradigms that are used to understand families, and this basically comes from the psychosocial theory and psychological background. Historically, the first school to develop was the psychodynamic school, where a lot of analytical theories were used in the 40s and the 50s. But the analytical and the dynamic school was rather long and difficult to understand, and so many people now do not use the psychodynamic school except for certain cases of families where you might do these therapies. The other school that is used rather prominently is the behavioral school of therapy, and the behavioral school of therapy lends itself to a lot of discussion with families which have chronic problems. And so families who have a person with, say, a mental disorder, or in a family where there is a child who's got a behavioral problem, in the behavioral method, essentially, though the family is viewed systemically, essentially the family members are taught different behavioral techniques to manage their problems. For example, if the person has got a mental illness, the mother or the father or the person who has the mental illness might be taught how to communicate with each other, how to manage difficult problems like violence or taking medication and so on. Or in the case of children, the parents might be taught parent-child training as to how to manage a difficult child. The two other schools which started and originated from the systemic school are what is called as the structural and strategic schools. Now, the structural school deals with looking at the family from the perspective of a structure in terms of having different components, and so this is more purely systemic in that sense. So the structural school basically looks at different dyads and triads, for example, dyads like husband and wife relationships, or triads like husband and wife and then the child and so on, and looks at the hierarchy of the subsystems, looks at the power relationships between people, and looks at the interactions between these different subsystems. And so much of the therapy that is done is basically to set right the dysfunction that is there in these subsystems in the family. The last and rather difficult or a little bit more esoteric school is what is called the strategic school. And the strategic school is essentially, as the word suggests, is a strategy that therapists use when they are stuck in therapy or they deal with very difficult families which resist change. So the strategic school is essentially a very brief therapy which the therapist adopts when the family is up with some resistance. And so this is a school that many people and novice therapists may not be very happy to do, because it's a little controversial and a little different. There are some newer approaches and schools in therapy, and those are schools like the narrative school, the constructivistic school, and so on. But these are all newer theoretical paradigms that have come. But essentially, these four components, the psychodynamic, the behavioral, the structural, and strategic schools, are the main components that are really are the main schools that are used in an approach to family therapy.
Thank you. With this sound foundation, let's move ahead and build on the components. Professor Varghese emphasized the importance of the systemic approach and the significance of the construal of the family life cycle. So may I now request Professor Rajalakshmi Sriram to focus on the need for family-centeredness in the context of therapy and counseling.
Thank you, Nirja. What I'd like to say here is that in general, when we are talking of families, especially in the Indian context, all of us have our notions are formulated on a myth. This whole issue of strong Indian families has been perpetuated for so long because we think there is this invisible family which has a lot of strengths and can cope with all situations. But actually, in reality, if we see, families today are faced with lots of challenges due to several changes that are occurring in the environment. You would have read it somewhere in your introductory chapters, so I'm not going to emphasize all of these. But families do have many, many challenges. At the same time, we need to recognize that families have many, many strengths. So what this family-centered approach means that we want to look at families. We want to understand them, the intricacies of family lives. We not only understand the problems, but we also understand the strengths of the families, the resources the family has. And therefore, in our work or in our intervention, we essentially do two things. One is we definitely understand the problem, but we also understand what are the competencies within the family which have to be enhanced, which have to be looked at, which have to be built in individuals and as a family. So what it does is, to overcome the challenges, it uses the strengths and resources that are present in the family very positively. So everybody is not looking at only the negative side of the family, but the positive features of the family are integrated, and the family is helped to overcome the problems. So when we say family-centered intervention, we essentially mean that we are not looking at only the problems, but we are looking at the strengths the family has, and then use those to combat the problems of the family. Now you might ask me, oh, what is new in this approach? We've been dealing with families all the time and this way. But I think essentially it's more like a rediscovery of it and endorsement of this approach more holistically, and development of systematic methods by which we could do it effectively. So there are 3 or 4 things that are very important for us to know when we say why this approach has become important. One is, everybody knows that any individual problem is rooted in the context, and family is a major context where the individual lives, irrespective of what type of family the individual lives in. So this belief that problems may be seen in an individual, but their recovery or the solution to problems rest in the environment along with the individual, and both the individual and the environment have to change if we want to see a sustainable change. That is, I think, the first belief that it is rooted in. The second is, there are sufficient scientific evidences and researches that have been conducted, both using qualitative paradigms and quantitative paradigms, all of which tell us that this method is very effective in solving problems or enhancing adjustment and development of individuals within families. The third thing is that it has worked in many, many different contexts, different racial groups, different ethnic groups, different castes, communities, deprived, affluent families. So in different contexts, this model has been quite successful. And also there is another field which you must be aware of, which says that it is evidence-based practice. So when you use the principles of evidence-based practice and understand family counseling or like family-centered work, then there are many positive advantages. And all these systematic steps also, if we go through, still it has come out to be a very, very strong method. Because of the strength of this method, this is being advocated. I wouldn't want to say that people are going to come and tell you that you use this or you use this. The person who uses is the best judge of what works in which situation. So it's almost like having an armory of tools or additional tools which you could use based on your context. But it is suitable for preventive developmental counseling or for finding solutions to small and big problems which families and individuals go through. Now, how is this kind of an approach used in practice? So in counseling, we quite counseling, therapy, or I'll say preventive, developmental, promotive interventions, if we want to use a more developmental stance, we use many, many techniques and tools to work with families. There are certain traditional methods which we're very familiar with, like conducting interviews, discussions, observations, assessment, checklists, scales, all these are all extremely useful. But in family-centered work, we go beyond this and help families participate as partners with us in the process of understanding the problems. So this participation can happen better if we have certain visual, pictorial, or experiential tools. So when we talk of these visual or pictorial tools, I can think of 2 very common methods that one could be used. One is called the genogram and the other is called the ecomap. The genogram is a paper and pencil technique. Both these are paper and pencil techniques, and it is here the therapist, the counselor, or the interventionist, he does not do the activity, but he or she facilitates the family to participate in the activity, and they do it together. In a genogram, we try to trace the family history over 1 or 2 generations to understand the problem. Supposing it is like the child has an adjustment problem in school, or he is not achieving success in school, or he's getting poor grades, or he's not good in maths, one would like to go to the family history and see in previous generation how people interacted, did anybody have the problem, or how it happened. So when the family draws this diagram together, they could see certain patterns of intergenerational transfers, or what factors could have triggered this. We can study more of this in a different session. There is no time to go delve into the details. But it is very, very helpful for family to understand the root cause, or from which context this problem may come, and they'll see patterns in their own family. The second paper and pencil technique would be called an eco map, which is very useful. Here, an ecological map of the family is drawn. That is, the participant or the client and the counselor sit together, and more than one person can participate in this. They could do different people could do different eco maps from the same family, or they could all sit together and do this eco map, where they try to plot the family interactions. It can be done at two levels. One is in the context of the family and plot relationships, plot resource flow, plot problems, everything between different family members. It could be an extended family or an individual family. So which we say intra-family dynamics. And when you plot this problem, you use four kinds of lines. One that indicates strong connections, the other that indicates weak connections, the third that indicates problematic, and the fourth that indicates flow of resources and strengths in the family. Similar diagram can be constructed for a family when you have, like, with the external environment, that is all the other social institutions. So what happens in this process is, together the family discovers where the problem is, and they can take joint decisions about the action that needs to be taken now. So families' competencies can be enhanced, and families itself will become desirous of enhancing the competencies. And the third thing, another example of more an experiential exercise could be called family sculpting, where what one would do is really to take a snapshot of the family at a particular period of time to understand the interactions and people's feelings. It is more intensive than the first two. So supposing there's a situation that what happens when a person in the family, supposing he's consuming alcohol, or supposing the person is in a lot of stress and comes back from work, and every day there's a fight or something, a scene is given to the family, and the family will draw a picture or enact what happens in that situation within the family. So different people can give their perspective. Supposing the wife enacted this situation, she would make a note of what would the husband do, what would the mother-in-law do, what would the son do. You'll get her perspective. If the husband were to enact this situation, you will get his perspective. If you get mother-in-law were to enact, you would get his perspective. So what happens is, if they did it together, each one will understand the perspective of the other person, and therefore the problem can be demystified to the family. So these are just some examples of these tools. And in general, what we need to do as counselors, if we want to use this approach more positively. So first of all, we must devise some strategies, whatever is convenient, whatever is suitable for engaging the families in our own environment, and develop these models based on further research or evidence-based practice, so we really know what can be done, which works in our context and which doesn't work. So even if it's not systematic research, I would recommend that whatever you're using, you would just document the experiences, so it becomes more useful. And focus on cultural diversity and see in which situations what techniques work better. And again, have different mechanisms where delivery of such services could be effectively used with different kinds of people. I hope some of these thoughts are useful to you.
There's no doubt, no practitioner or theorist will put any question mark on the need for family-centeredness. And with this agreement, with this critical aspect having been sufficiently articulated, highlighted, and I hope it has registered in the minds of the aspiring practitioners. Yes, Ahmedabad, come in.
The question is, in evidence-based practice, what issues arise in responding to privacy needs and human rights of individuals vis-a-vis family system?
There are evidences where exploitation we see And in this age of consumerism and human rights, we have to be very, very careful. Service delivery is not the only thing. Legal aspects are looked to be seriously with ethical consideration. So when we are practicing in the community, the confidentiality part, looking at the rights of the victim, either he is a severely mentally ill person or a person with disability or a child with disability. And then certification, if the need be, quantification of disability, because all this is related to some kind of concession and facilities available to the people. And awareness about rights of a person with disability or victim of severe mental illness has to be looked into in practice. And the last thing is the setting the limits. We should be very, very clear what is required. Prescribing medicine, if hospitalization is required, that has to be seriously looked into, and he should be referred. So as we discussed yesterday, things are complementary to each other. If pharmacotherapy is required, counselor will not do everything. So psychosocial and pharmacotherapy both are complementary to each other, but in this background, along with service delivery, the legal aspect, ethical aspect and sensitivity to rights has to be looked into, along with confidentiality. Because in family issues we discuss lot of things like relationship issues and several other family issues, and family along with the client should be assured that this is only for therapeutic purpose and it will not be used for anything else. Yeah, just to add on this, because service delivery is not the only thing. Now we also need to look into the ethical aspect, legal aspect and the sensitivity to human rights. First of all, we all know there are some kind of concession facilities available to these people from the state government, central government. For that, certification is required. Along with certification, degree quantification of degree of disability. So how to do it, where to do it, and getting all these benefits for the client in the family will be very, very necessary. The second thing is, along with service delivery and family therapy and counseling, many a times we need to set the limits, what counselor can do and where medical help is required. Because in the community things doesn't happen as we read, as we write. Community things are very, very different. And then there are legal issues related to property, marital disharmony, divorce related cases. So dealing with all these issues in the family is also an area of counseling and family therapy, and a counselor assisting families should be very, very careful in dealing with these issues. And lastly, as I said, the confidentiality part. The confidentiality part is so important because your client or family should have faith that here is a person who is helping us, and any information given to him will not be used for any other purpose. This will be used exclusively for therapeutic help.
Thank you, Professor Singh. Now I request Professor Ahilya Raghuram, Professor and Head from Department of Mental Health and Social Psychology, NIMHAS, to give some view on role of reflections in counseling and family therapy.
Thank you, Amiteshwar. The need for therapists to be reflective about their own practice is an extremely crucial one, which will actually go a long way in improving the quality of care and the quality of the therapeutic services they provide. Now, I would like to talk about this with regard to two issues. One, the need for therapists themselves to be reflective about their own practices, and what is the role of reflection in the process of training therapists in order to make them more effective and better therapists and counselors. It is extremely important that all therapists at the conclusion of a therapeutic session should take some time to sit back and reflect on what has transpired during the session. This is necessary for all forms of therapy, individual as well as couple and family therapy, but perhaps much more important in the case of couple and family therapy, because we are attending to responses and reactions not from just one individual but from more than one individual who is present in the session. And therefore it's possible that the therapist may not have had adequate time to have processed all that information while the session is going on itself. And many times it is only when one sits back and thinks about what transpired during the session that many other things, non-verbal responses or certain statements or certain bits of information that different members of the family may have shared actually comes into focus. Therefore, it is important to sit back and take this time to sit and reflect on several aspects. That is, one, the verbal content of what was discussed and shared during the session. Then the next level of reflection that one needs to do is to think about what were the emotional responses of the different family members while the session was going on. And the third level is to think about what were the therapist's own emotional responses to what was being discussed and shared. Because therapists are very deeply and intimately involved, intensely involved in the sessions, and much of what is discussed may at times strike a chord within the therapist based on their own developmental and family experiences. So it's important that they should also pay attention to what were their own emotional reactions, what were their own belief systems or attitudes that that struck a chord with what was being discussed in the sessions. Now, this is with regard to the practicing therapists themselves. To an extent, this process of reflection by therapists can also be facilitated by having a group constituting of peers, other therapists who are also practitioners. And sometimes this kind of a peer group helps and facilitates the process of sharing amongst therapists and deepens the reflective process as well. But this capacity to reflect is something that needs to be cultivated and developed during the course of training itself. It is not that therapists automatically gain the skill. Yes, there might be some therapists who have a natural inclination to be a little bit more introspective and reflective, but for most others it is something that needs to be practiced and developed over a period of time, particularly during the course of their training. Which is why when trainee therapists undertake sessions with a family or a couple or whatever, they must be encouraged to either audio tape some of their initial sessions, or if that is not possible, or if for whatever reason the couple or family does not wish to give consent for the audio taping, then the next best alternative would be to encourage them to maintain a verbatim account of whatever transpired during the session and then take these verbatim notes for discussion with a supervisor. And by using this information, the trainee therapist can also be encouraged to reflect on various aspects. As I had mentioned earlier, the verbal content, the emotional responses of the clients or the family members, and the trainee therapist's own feelings, emotions and attitudes that were aroused by the discussion itself.
Now I request again Professor Rajalakshmi Shriram to give us an insight on cultural sensitivity and gender sensitivity in counseling and family therapy perspective.
You know, when I'm talking to you, I'm really reminded of one of the workshops which I conducted some years ago. This was for all the established.
3 minutes.
This was for all the established family therapists, not family therapists. We have a lot of family counseling centers in our country. So all these people were together, and we had designed a program, and we were requested to conduct a program on having gender, culture and family sensitive interventions. This was an intensive training program for 5 days. And then, as usual, like you all know, the first sessions we do of introductions and what does everybody do, and we were just discussing what does counseling mean, and everybody's notion and perspective or perception about counseling. Different things came. What was interesting is that one question, what do you all do in the centers? What we all do? And then the counselor has a position, a role that is assigned to her or him by society or by the institution. And so-called, into quotes I would like to say, you're called a helping profession. So what does a helping professional do? You're supposed to help the client. So how will I help the client? Then everybody started saying that when the client comes in distress, I have to do something to relieve the distress of the client. So what will we do? I would like to use a Hindi term. They said, उनकी तकलीफ होती है तो फिर हम उनको सलाह देते हैं, or we will direct them to what they're supposed to do now. These are the possible options and you choose one. And sometimes they said, we ask the client to come next time, but the client does not come sometimes. So we don't know, they disappear, they're not interested in getting help and all that. So we said, let's delve more into this. And then as we started discussing, everybody came up with a bright idea that maybe what we are giving is not what is suitable or what the person expects to have. It doesn't fit in with the circumstance or the context or what the person desires to do. So understanding the position of the person in the context, either because she is a man or a woman or of a particular gender or belongs to a particular culture, maybe social class, maybe she's a Dalit woman, she's a rich woman, she is a woman who is facing violence, he's a man who is not earning enough and thrown away from the family, he's an alcoholic and the community views him in a very negative way. Whatever the situation is, it is from that situation, from the perspective of the culture or the gender that the person is involved in. So we have to understand it from that perspective. So when we are understanding from this perspective, what all we should do and what all we should not do. And gender, as you would know, is not a very major issue of an individual, but it is of the society and social structures. So what are the things that we must remember not to do? First I will say that, and what we have to do, we can look at. This is, we do not make evaluations or put words into the mouth of the client when we are discussing, आपको ऐसा होता है कि आपको ऐसा होता है. Listen to the client very carefully, understand what the situation and of the person is within the family, mainly from the perspective of power relations, because the counselor also has a lot of power on the client, so don't impose your power and give directions to the client. The second one is not to make judgments as good or bad, be evaluative, that आपने ये कहा तो ये सही है, ये गलत है, ऐसा होना चाहिए, वैसा होना चाहिए, so you should do it, you shouldn't do it. So judgments of your family is bad or your family is good, though we do not say it obviously, many subtle things are done in such a fashion, that should be totally avoided. And third is to make decisions on behalf of the client. Let the client experience, let the client analyze one's own situation and think of what the position is, what are the cultural dictates. Certain norms are approved in a particular community, those norms are not approved in our community, so the client situation is totally different and the counselor's situation is totally different. So we have to look at what is suitable for the client from the perspective of gender, from the perspective of the power relations, from the perspective of the culture, and then root our counseling process into that. Otherwise, I think our counseling or whatever efforts we make is totally futile and it will not empower the person. Empowering is the person does not have to come again and again to you, but the person develops enough confidence and power to alter situations in his own life. So from that perspective, I think gender is very, very important, and culture, both will help in democratizing family processes.
Sriram, for giving us an insight about the use of culture and gender sensitivity in counseling and family therapy. With this, we come to an end on this panel discussion on perspectives on counseling and family therapy. Thank you.